Hi, my name is Katelyn Franck, and I am a third-year osteopathic medical student at University of the Incarnate Word School of Osteopathic Medicine.
And I'm Margaret Jonas, also a third-year osteopathic medical student at UIW School of Osteopathic Medicine.
Our presentation is titled Perspectives on Healthcare Decisions and Total Joint Arthroplasty from the South Side of San Antonio, a major minority region. The purpose of this study is to identify cultural, social, and socioeconomic factors that influence a person's decision to pursue medical attention and undergo a surgical joint replacement procedure due to osteoarthritis. Total knee arthroplasty is a common and successful osteoarthritis treatment that significantly decreases pain level and improves the quality of life. The Hispanic population in the United States utilizes total knee arthroplasty 20 to 30% less when compared to non-Hispanic whites, despite a similar incidence of osteoarthritis. Patient preferences, expected outcomes, religion, patient and provider level factors, hospital distance, and patients' willingness to travel are among the factors that have been associated with disparities, but that fails to explain underutilization. Moreover, a public insurance program like Medicare is the largest payer of these procedures, yet these disparities persist. Poor surgical outcomes may be driving this underutilization, but social, cultural, and socioeconomic factors underlying underutilization are not well studied. These factors are separate but likely related elements that require further investigation. This study encompasses the behavioral model of osteopathic medicine, investigating the mental, emotional, and spiritual impacts on patient care. In order to rectify TKA underutilization, it is critical to understand patient perspectives on their own health care and decisions regarding osteoarthritis treatment. Additionally, focusing on a specific cohort will allow physicians to deliver more culturally competent care. This study is approved by the UIW Institutional Review Board. It is a cross-sectional survey study. Subjects were recruited in person at community events and centers in Districts 3 and 4 of San Antonio, Texas. Subjects were eligible to complete the survey if they were between the ages of 50 and 89, residents of Bexar County, and fluent in English. All voluntary responses were kept anonymous and no identifiers were collected. Surveys consisted of a combination of specific questions and Likert scale questions to determine the subject's economic status, pain tolerance, health literacy, family support conditions, and other factors that influence a person's decision to seek medical treatment. The study is ongoing, and as of September 24, 2020, there are 113 respondents.
Let's look at the first set of responses that are from all respondents. Of the 113 subjects, 62.5% identified as Hispanic, 98% of subjects have health insurance, 78.5% indicated satisfaction with their current health insurance, and 73.2% were comfortable with their medical knowledge. Now, these results on this slide are specific to the subset of patients that reported daily hip and knee pain. Among these respondents, 47.1% indicated financial concerns would prevent them from pursuing surgery. Half believed joint replacement surgery is common and successful for hip and knee arthritis, but 40.8% and 43.1% respectively reported they would avoid a total joint arthroplasty due to fear or cost, even though the surgery could alleviate their joint pain. This slide presents data comparing males and females. Females were more likely to choose a doctor based on geographic proximity, they were less likely to ask others for help, and they demonstrated a preference that their health does not affect other people. In comparison to women, men were more comfortable receiving help to make healthcare decisions, although females reported a higher rate of clinical diagnosis of knee osteoarthritis. There was no significant difference in reported daily pain. Among participants with daily knee pain, a strong trend indicated that females were less likely to be influenced by a relative's, friends, or someone else's surgical experience or outcome. This slide compares responses between those who identify as Hispanic and those who identify as non-Hispanic white. 3 salient outcomes were seen between the two ethnicities. First, Hispanics were more likely to report an above-average pain tolerance. Second, Hispanics also reported a greater fear of undergoing a joint replacement. And finally, Hispanics reported a preference to avoid total joint replacement procedures. These results provide us with a glimpse into the complexity of the patient healthcare experience in San Antonio. Patients do perceive joint replacement surgery favorably, but fear, finances, and doubts about the benefit of the procedure appear to fuel decisions not to pursue surgery. This may represent a few factors that underlie total knee arthroplasty underutilization in these subjects from the south side of San Antonio. Hispanic patients are a medically underserved community, and our study is unique in that our respondents are predominantly Hispanic. We also found that when compared to males, females are less likely to ask for help with their healthcare decisions and do not like their health to affect those around them. A patient's perception of a medical treatment not only influences his or her medical decision making, but it also affects their medical care they receive as well. We believe that once a better understanding of the factors driving underutilization rates is achieved, providers will be able to better educate their patients on the risks and benefits of total knee arthroplasty. Having a better understanding of the patient experience also allows us to deliver more culturally competent care and train future physicians with a greater understanding of the patient healthcare experience.